All right, Lagos. Yes, indeed. It is another Thursday. Time to talk about our health here on Smooth 98.1. It is always a pleasure to do that. I love talking about health. If you know me, you know well. Even when my voice or even if I'm low, I like to talk about our health. And today is not going to be any different. Today we're going to be talking about breast cancer. Mm. You would think it only affects the women. Oh, when you hear breast cancer, the first thing you're thinking is, oh, it's just for the women. Nothing concern me. Is women conversation? No. Breast cancer has no gender. And that's why we need to understand it. Statistics actually show for the US, I haven't checked about the stats for Nigeria, at least 2,600 men have breast cancer, whether by family lineage, somehow, somewhere, they have breast cancer. So in case you, like Charles Chidozie was teasing earlier on and said he has no boobs, you do have boobs, and you have breasts, and he can have cancer. All right, joining me to expand and share insight on this conversation is Dr. Oluyode Olawole Glory. He is a consultant radiation and clinical oncologist at Iwosan Lagun Hospital. Glad to have you with me this evening.
Yeah, thank you very much, Joy. I'm glad to be here too.
Okie doke. So let's even get into the conversation because earlier we were just teasing about it. When people hear breast cancer, they only mostly think about women. They never think about the and how it can affect a man, but men have it as well. How is that even? Well, I wouldn't say how is it even possible, but for a lay person who doesn't even know that a man can have breast cancer, please help us work us through.
Thank you very much, Joy. So let's remove the breast from the word breast cancer. Let's start from the word cancer.
Okay.
So cancer itself is a group of cells. So cancer is a cell, is what we cannot see with our eyes, our naked eyes. So when they come together, normal cells, when they become abnormal, okay, then they transform into what we call malignant cells or cancerous cells. So if it happens in the breast tissue, we call it breast cancer. If it's happening in the colon cancer, prostate cancer. So it's abnormality in the cell formation that turn malignant. So they become uncontrolled and they begin to invade other structure in the body. So cancer itself is a group of cells, and wherever it is being located, there will be no
How it
name
is
here. So
attached to that.
breast cancer. Yes,
Okay.
that's that. They want me to go further?
Yes. So now so we can understand when in more in-depth explanation as to how it affects not just the woman but the man as well.
So men and women have breasts normally. All of us we grow up with breasts. The only thing that differentiates men from women is that the estrogen in women makes the breast to become bigger and prominent that we can all see.
Right.
Because men develop testosterone, so the estrogen level goes down. It's low, but we still have estrogen.
Okay.
So the testosterone level make it look like we don't have breasts, but we have breasts. The difference between male breast and female breast is that in female breast they have what we call lobes, dots, fat that can produce milk, but men don't have that dot that can do that. But yes, we have tissue, we have breast tissue.
Right.
So and the combination of different cells make up a tissue. So if cancer is going to develop from the cell, men have breast cell, hence they can develop breast cancer. So basically, that's that.
Okay.
Yeah.
All right. Wale is already here. Hi, Wale. Good evening. Wale says, what's the difference between breast tumor and cancer?
Okay. So the word cancer, it means that. So let me start from the beginning. Cells, as I said earlier, is our normal body cells. When they grow old or when they age, they're supposed to die out, and another one is formed. So when our cells grow old or it age or is injured or there's something around it, our body's supposed to
clear it out. Because
and produce a new one. But when that is not done, they call those cells abnormal cells. These cells are the ones that are now formed and turn to what? Cancerous cell. However, tumor is a combination of cells, okay, but they are also abnormal, but they didn't turn malignant. What do I mean? Tumor
Oh,
is
okay.
is what we also call lump, or we also call mass. It's a combination of different cells too. They are abnormal cells, but their characteristics is that they don't have ability to invade other structure. So you can leave someone with a tumor, okay, and it can just be like that. When we take a biopsy of that tumor, we now know the content of that cell in that tumor. Is it a bad one or a good one? A bad one means malignant, which you can also call cancerous. Then if it's good one in quotes, it's not that it's good, but if it's good one
If
in
it's
quotes,
something that's not going to, in a
it
sense,
not invade other structure, we
right.
call it benign. So tumors can be cancerous. Do you understand? So we have tumors. So all cancers are tumor, but not all tumor are cancers. So in tumor, you can find benign or malignant.
Okay.
But cancer is coming from tumor, but tumor may not necessarily be a malignant cell. And that's why when you see a lump, a mass, or anything, we ask you, please, let's take a biopsy of that. Biopsy is a procedure whereby we take tissue sample. That sample, we take it to a lab. A pathologist will check it under a microscope, and they see the cell. The characteristics of that cell is what we now name it. So if it's benign, is a in quotes good tumor. Okay, if it's malignant,
That's
that
when
this, so if
you need to remove
yeah,
it.
you need to remove it, something like that. So all cancers are tumor, but not all tumor are cancers. And majority of females that have breast lump, breast mass, most of them are actually tumor and they are not cancerous. So it's only few of them that are malignant. This few is even alarming.
Ouch. Okay.
Yeah.
The more you know, right?
Yeah.
Well, now you've already touched on something. At least you've cleared that. I hope, Wally, that answers your question. But what are the signs, early signs of breast cancer that one needs to? I'm not just talking about for the female. I'm talking about even the men. I know that when a woman goes to the clinic, there's usual they tell you if it looks like it looks like an orange. Yeah, so
we expect the breast to be smooth.
right.
So, but the surface of the brain is not smooth. It's like dimpling or something like that. And it's also thickened. We don't expect breast to be very thick or to be hard or thin. That we don't expect that. So the early sign of breast and the most common sign is lump, the combination of or the coming together of different cells to form lump or mass or tumor. That is the early sign of that. And it's common, but some people don't present with lump in the breast. Some present with lump in the armpit. And most of the time, men, because they don't have prominent breasts, they may not notice that. But it will be growing. They won't know. By the time a man is aware that there's a mass going on underneath his skin, under his breast,
It becomes
it has gone further than one can even, reverse back. But for a female, it's prominent because female, they tend to one way or the other touch the breast. They know that what is on the right breast is not the
it's
same
not
on the left
something
breast.
is not
Yeah,
right.
thank you, something is not right. So man can know, and women can know, but most men
Don't
not,
even realize.
and even they notice, most men, even when they notice, they don't come to the hospital because when they look at it and somebody's telling them maybe breast or maybe breast cancer, they know why
It's just under
is a
what.
cancer, thank you, or a cancer of the femur is not my issue. Because some men, because they are shy, or
Oh
some
my goodness.
the earth-seeking behavior of men is lower compared to females. So things like that, men don't talk. So but the important thing there is that men can have breast CA, women can have breast CA. And the difference also is that it's commoner in women. For every 99% of women having breast cancer, 1% of men is having it. So it's rare for men, but it's there. And the age at which it happens for women, from 20, 30, 40, mostly around 50 or postmenopausal, yeah, they have breast cancer. But for men, they may not notice that until maybe they when they are 60 or 70. So, and most
So it
men would
doesn't
have
present
early for men, and most men would have even died before that, based on our life expectancies. So you get so it's not that common. But if somebody has family history or something, man can develop breast cancer. So if I'm talking too fast or too much, let me know.
It's not fast.
Yeah.
It's just clarifying things.
Yeah.
So in case you were wondering, okay, so doctor has said it's women, it will present first early. Don't think that you cannot pass it through your gene. It's still important to look out and be mindful. But we have a quick breather coming through. Let's take that. When we get back in, we'll get to understand what the risks factors are, and what to look out for. Even though women check regularly, how often should they check? And you as a partner, can you also help in that instance? Well, we'll get to talk about that and much more. Don't move a muscle, Lagos. Stay tuned to Smooth 98.1. This is Smooth Health on the Drive. Thank you.
Well, let's keep the conversation going.
No. The conversation needs to go. let's not jump everything.
Go on, yeah.
Hey, we're enjoying it, trust me. Basically, it's a 6 minutes 20 talk time for every 6 minutes call I make every day. Okay.
Those 50 MB data on every 6 minutes call you make in a day. Unclose Blockbuster and enjoy a one-time 2,000 naira welcome bonus plus the 25 minutes talk time and 1 gigabyte worth of data. Get your Glow line and dial *606# to enjoy. Terms and conditions apply. This is Smooth Health on the Drive. This is Smooth Health on the Drive. All right, let's get back in. All right, Lagos. It is 32 minutes gone plus 5. You are tuned into Smooth Health here on Smooth 98.1, and it is a pleasure to be talking to you today. Today, we're talking about breast cancer and trying to, break this myth and understand a lot of where breast cancer is concerned, at least where cancer is concerned in the breast. And bearing in mind, it has no gender. As opposed to what some people have thought, oh, it's only for the women, it doesn't affect the men. Well, thankfully, I have my guest in the studio in the person of Dr. Oluyode Olawole Glory. He is a consultant radiation and clinical oncologist at Iwosan Lagun Specialist Hospital, and he's been giving me great insights. Yeah. Even some that we've been, giggling in the background. So let's talk about, detection. I know that earlier on we were talking about how it is where the men are concerned. They would wait till something is more or less killing them before they get to find out. But for the women, you find out that they're always trying to see, okay, what are the things we need to check around? So, as much as we know women should be checking, should men also be doing this?
Yes. The screening for breast, that is so it's not necessarily that it's because we're looking for breast cancer actually, but there's this motto that says that early detection saves lives.
Right.
So one of the reasons why we are doing this is to let people be aware that first, breast cancer is the commonest cancer right now in Nigeria and in Africa, and it's the most common cancer in the world after lung cancer. So it's a major thing, it's a major public health issue, and people should be aware of that. And the same way, women check for their for breast examination, men should also do the same. And it's simple.
Okay. So
breast self-examination or self-breast examination. It means that once in a month, a woman can check her right breast with her left hand and her left breast with her right hand. You check starting from the nipple down outwardly. So from inner part, you check every quadrant of the breast and check for any abnormality comparing the right and the left. And men should also be able to do that. And if one is up to age 40 and above, you can do once in a year a check with mammogram. Right. So you just go to hospital, they will check for you, expert to check that for you. And if there's no family history of cancer or any malignancy, I mean, people can present in hospital once in 3 years. Let a clinician check it for you. And if there's any family issue or the person have high risk, it can be once in a year. The clinician can check whether a doctor or a nurse can check professionally the breast for both men and women. So that's just the screening thing that we do. Mammogram,
Okay.
breast ultrasound scan for people that are less than 40 or 35. Okay. Clinical breast examination by a doctor once in a year or once in 3 years, and personal check once in a month, most especially after menses, maybe 5 days or a week after menstruation, women should check.
Okay.
Yeah.
Well, let's digress a bit. I know we're still talking about screening and checking.
Yeah.
So for the females, is it also the same with the armpit?
Yeah.
Are they supposed to also check just as
down
I know
to the armpit? Yeah. Sometimes lump may not be in the breast. The lump can actually be only in the armpit. I've seen cases like that. They won't say anything in the breast, but they just notice that something is moving in the armpit. Something that's moved by, is it a boil? Is it not a boil? Don't assume it's a boil. If you are not sure, let a professional check it for you, and from there we take it up. Okay. So yes, breast cancer can start from the armpit, basically.
Right.
So it's not necessarily that it must be in the breast. Yeah.
So this is me just being playing devil's advocate at this point in time. So take for instance a male or female does the check and finds out that this just realize there's one small fat. But there's no pain, there's nothing, it's just there.
Yeah, so it's good for noticing that it's good for everybody. Okay. But you take a step further. Don't assume it's just fat. Because what one is calling fat may not be fat, it may actually be a lump, it may be a mass, it may be mobile, it may look like fat to the person, but it may not be fat. So don't assume. Let a professional check it for you, whether a nurse or a doctor. Come to the hospital, be assurance double sure. And once you can do that, you'll be assured that it's not fat. So if it's fat, then you can move on with your life. Do you understand?
Fear is the thing that makes people avoid going to the hospital. The thoughts that anything they could just hear the slightest thing and then, oh my days. It just feels like you've been handed a death sentence just by hearing that, this is what it is.
Please, can I cut in? I think I just want to beg our listener that if you have a disease that it is number one among female in Nigeria, I don't think it's not something that one should be interested in. I think it's something that everybody should be interested in because one, it doesn't. It's not based on what you have done, what you have not done. Okay, it can happen to anybody.
Anyone at any point in time.
It's easier to eat it headlong. It's easier to face it. Defense, the best form of defense
is attack.
So it's first you need to accept that this thing is here. It's here with us. It's happening. Right. Okay, and many women are coming down with it. Okay, and doing this, we are able to pick it early. And it won't be a death sentence if it's picked early because most breast cancers are curable, actually. Forget the stories that people,
so it's the malignant ones, the ones that have been there for the longest time
untreated, that has even spread to other organs, affected the lungs, affected the kidney, has gone to the brain, crippled the spine. Those ones are the ones that we don't really have good outcome with. But the one that is still localized is small. Right now, it is curable. So it's not a death sentence. So it's something that we need to first see that is happening in our environment right now. We need to eat it headlong and have good outcome. Many people have treated this and they survived. So doing it is not that if I don't do it, it won't be there. What if it's there?
It's better to be sure than not. It's better to know than not to know what, just to be kept in the dark. But you know the notion that what you don't know doesn't kill you. That's not in this case. Sometimes ignorance isn't bliss. So you want to find out and be, I would like to say, double sure and safe. It's better to be safe than sorry, because if you are attacking it earlier on, it saves you a whole lot than if you are trying to now treat the entire
trying to survive it.
That's a whole lot of expense. But now let's talk about lifestyle. How can a person's lifestyle affect,
or developing breast seed?
Yes,
our lifestyle is very important, not just for breast cancer, general well-being. Lifestyle is very important, and the lifestyle is the dietary lifestyle, alcohol consumption, smoking, and all those things. They actually affect development of.
You doctors are no fun, because how are we supposed not to enjoy this life?
So it's important that we are also aware of these things. For instance, someone that is obese or that the weight is going over the roof is at risk of developing breast cancer. And some people have that in the gene, and some may be due to what they eat and lack of exercise. The fat itself, when it breaks down, it produces more estrogen. And estrogen is responsible for the cell growth in the breast. When it's in excess, it transforms this cell to become abnormal, and one can develop breast cancer. So if one can increase exercise, reduce the fat level, we have less amount of estrogen, or the moderate amount that the body needs, and the person is good. And that is one. The other part of it is alcohol. Alcohol can predispose someone to have breast cancer. Why? Because this alcohol affects the liver. Liver removes toxins in the body. Aside removing toxins, also balances the hormone level, the hormone level in the body. Now, when alcohol affects the liver, it impairs the function of the liver to remove toxins. That is one, which can cause another issue
entirely.
Then the part of breast cancer is that it causes hormonal imbalance. Hence, someone can have more estrogen level. You won't be able to correct when the correction needs to be done. Such person is predisposed to breast cancer, and that can happen to both male and female. So smoking too does the same thing. So we have all the lifestyle is very important. And so when we eat right, we are what we eat. So lifestyle is very important in preventing, breast cancer in every person. Yeah.
Ovina, I'm sure that this is not this is just people peddling things, but I hear you. The doctor has also read your message. Well, he's basically asking if, because some journals and especially people who are peddling things online usually talk about how by sucking or helping the woman to massage the breast can also reduce
the chance of breast cancer. Okay,
how true is this?
So it is true for
the massage.
What's it called? Breastfeeding mothers.
Okay.
So it's not true for one that is not breastfeeding.
Right.
So and the idea behind it is that when a woman gives birth, they produce milk from the breast.
True.
That period of producing milk from the breast stop them from having menstruation. It means that they won't release egg, the estrogen level goes down. So that prevents abnormal hormones causing so baby sucking, the more baby sucks, the more the time of starting menses is delayed.
Okay.
Compared to most women that did not breastfeed at all. They tend to commence menstruation earlier. Do you understand? Compared to mothers that breastfeed. So the more they breastfeed, the more they have this period of amenorrhea. Amenorrhea means that they are not menstruating, and that is protective. Okay. And that is why they encourage their mothers, please give baby
your baby as much as
men have done it too. It's okay if you can help her out. It's okay. We are not against it. Okay, so that is that. And so we need to also understand the idea about the risk factors for breast cancer is a longer exposure to estrogen level. So women that started their menses very early in life, or that stopped their menses very late in life, they tend to they are at risk from breast cancer. Women that have multiple pregnancies, they are protected compared to women that are not giving birth, because when one is pregnant, they are not menstruating. They understand. Okay. And the hormonal level is so. Those are those things, including breastfeeding.
Okay. Yeah. Makes a whole lot of sense. Obina, I trust your question has been answered right now. Okay, so it's for breastfeeding mothers and not And not as you assume, but it's okay.
Yeah.
Before I let you go, what would be your advice to not just women now, but to men as well regarding paying attention to their health? Even though we're talking about the breast, but okay.
Yeah. We should have this positive mind to live and survive. We should also make use of all this awareness. We are not, it was Lagon, I suppose, it's not the only one shouting about this. Almost everybody's shouting about this thing. If it's not existing, nobody will talk about it. So now that we are talking about it,
Right.
make use of this opportunity to check yourself. I mean, some people have never done breast self examination before. Please do it now. Right now in the Lagoon Hospital, you won't believe that they are doing promo for everyone that comes to Lagoon Hospital. You are able to see oncologists for free. So if you want to say, oh, I'm afraid, I don't know this thing I've seen in my breast, or I need a doctor to check something for me. To see doctor, the fear of going to hospital, the money and the rest, Islam is doing it free for month of October and November. And they're also doing screening discounted amounts. So mammogram, if somebody wants to do mammogram, is done once in a year.
Yeah.
So mammogram that can be as high as maybe different centers, they got different money, but it was Lagoon is doing it for 10K. For with 10K, you can do that's once in a year. I mean, you make use of this opportunity. Just come to the hospital, check, and other programs that people do to let people be aware of what is happening.
Right.
Make use of it. Don't ignore. Don't say God forbid. Yeah, we don't want. We are not praying for.
Yes, indeed. I get that.
But this is important for you to get yourself checked.
Make sure why the sun sets.
Thank you very much. Yeah.
Right.
Yeah.
Okay, Gos. I'm sure that you've learned a thing or two about your breast, male, female. Important to take it seriously. Okay, before I go, there's a question that's just popped up. Okay. Thank you so much, Emeka, for this question. Emeka is asking, are there drugs like contraceptives that can trigger hormones that will also form cancer in the breast?
Yes, oral contraceptive pills. In fact, it's one of the risk factors for breast cancer. And it's long use of oral contraceptive because oral contraceptive,
long use.
Yes, as high as 5 years and above.
Ouch.
There's tendency that one may develop breast cancer because the content of that oral contraceptive pill has estrogen in it. And estrogen can trigger, breast cell growth. Yeah.
Okay. Well, thank you so much for all that insight. It's been really insightful, and I'm glad that I can see there's men that asked the question today. Ladies.
That's very good.
For the men, see,
awesome.
We're clapping. Awesome stuff. Usually I have the ladies asking the questions, but I'm glad to have the men ask the questions and get more insights. It means, hey, they want to be kept abreast and want to be aware. But so for our listeners now, how can they reach out to you to get further insights on your social media handle?
So on my social media handles, you can reach out to me on Twitter. I'm very active on Twitter. Oluyode Glory at Oluyode Glory. Okay. So Oluyode Glory, no space. Then you will get to me, and you can also reach out to Lagoon Hospital. Actually, go online. You can book an appointment. It's free consultation for anybody coming to Lagoon Hospital with discounted stuff. So you can also go to Lagoon, whether Instagram, Facebook, or LinkedIn, anywhere you get. Once you ask any question, we get back to you.
And that's as soon as possible. All right, Lagos, that's the much we can take today on Smooth Health. As always, you want to take care of yourself because if you don't, your body would ask it for you. There's still much more lined up for you. So don't move a muscle. Stay tuned to your Smooth 98.1.
Thank you.
Every Thursday at 5:15.